10 peculiar indicators that your liver is damaged. We're going to talk about some early warning indicators of liver impairment in today's video. Because the liver can mend itself with adequate care, being aware of these indicators can help you take proactive measures to prevent the condition from growing worse. In the United States, 25% of individuals suffer from liver disease, according to data from the American Liver Foundation. Causes of liver disease. Contrary to popular belief, there are other factors that might harm the liver than excessive alcohol use. Other things include eating processed meals, ingesting excessive amounts of sugar and vegetable oils, using excessive amounts of medications, and infections can also cause liver damage. Watch this video through to the end to find out if there are any issues with your liver. We'll also go over some natural home remedies to clean your liver and stop more damage. Signs of liver damage. Number 1. Pale stool. Stools that are excessively pale may indicate liver disease. In order to process food and fats, our livers create bile when we eat. This is what gives the feces its typical brown color, but it can also make it harder for bile to pass through the bile ducts if your liver is injured or obese. The stool now has a lighter, paler, or clay-colored hue as a result of this. Your feces may become buoyant and float on the surface of the toilet water as a result of lipids not being properly digested. Don't disregard these symptoms and get help from a doctor right away. Number 2. Nyctalopia. Nyctalopia, or poor night vision, is another indicator of liver disease. It is a condition where a person has trouble seeing in dim or dark environments. Toxin filtering and protein synthesis, including the production of retinol-binding protein, which carries vitamin A to the retina, are known functions of the liver. Damage to the liver can result in a vitamin A deficit, which impacts the retinal cells that are in charge of night vision. It's critical to consult a physician if you have impaired night vision, as this might be a sign of liver damage. Number 3. Swollen right foot. Peripheral edema, or the swelling of tissues, is a disease that can result from liver failure and often affects the legs and feet. Damage to the liver can prevent it from producing enough albumin, a protein that keeps the body's fluid balance in check. Because of the way blood circulates through the body, this imbalance can cause fluid to build in the lower extremities, especially on the right side, resulting in swollen feet. Before moving on, if you are enjoying the video so far, make sure you subscribe to our channel so you never miss any of our latest videos. Number 4. White or yellow bumps around the eyelids. When you notice white or yellowish growths around your eyelids, it's another strange indicator that your liver is damaged. Xanthelasma, or little packets or lumps around the eyelids, are deposits of cholesterol. A liver disease causes the liver to stop processing cholesterol, which causes it to accumulate in other areas of the body, including the eyelids. Don't ignore xanthelasma and get a liver checkup as soon as possible, as it may indicate liver illness. Number 5. Right-sided pressure. The right side of the rib cage experiencing pressure or discomfort, particularly after eating, is another notable indicator of possible liver disease. In essence, liver disease causes your liver's bile to thicken and sludge, which obstructs the tiny ducts that lead to your gallbladder. This accumulation of sludge compresses your ribs and may even interfere with your phrenic nerve, resulting in right shoulder pain and tightness in the muscles. It's critical to identify these feelings as potential indicators of liver issues so that you can get treatment before it's too late. Number 6. Purple or red bumps on the skin. Medical science states that a damaged liver cannot manufacture certain proteins, like fibrinogen, which is essential to the coagulation cascade and necessary for blood clotting. This implies that you are more likely to bruise easily, which may cause odd purple and red spots or bumps to form on your skin as a rash. These are primarily seen in the arms and lower legs. They can also be brought on by impaired blood circulation, which is another symptom of liver disease. Number 7. Cracked heels. Hepatic injury may be indicated by cracked heels. Niacin, or vitamin B3, is used by our body to keep our skin robust, smooth, and hydrated so that it won't be damaged. But in an effort to heal itself, our injured liver eats up all the vitamin B3 that is stored. The heels, soles, and feet crack as a result of this vitamin B3 shortage. This little signal shouldn't be disregarded since it can point to liver damage. Number 8. White or swollen nails. Nail swell or turning white may be a sign of severe liver disease or another underlying medical condition that limits the nail's ability to get oxygen. A research done in the 1950s showed a high association between liver health and nail appearance. 8 out of 10 people with extensive liver scarring had entirely white nails. Clubbed nails, which are characterized by swollen spherical fingertips, can also be an indication of persistent hypoxia, which is frequently linked to liver conditions like cirrhosis. Early detection of liver problems might be aided by keeping an eye on changes in the look of the nails in addition to other symptoms. Number 9. Dark urine. Urine that is dark yellow or brown in hue is an indication that there may be damage to our liver. Bilirubin, the yellow pigment that gives urine its color, is one of the waste products from the blood that the liver is essential in filtering and digesting. Damage to the liver may prevent it from effectively filtering bilirubin, which can accumulate in the body and darken urine. This may indicate a number of liver diseases, including liver cancer, cirrhosis, or hepatitis. Number 10. Jaundice. One important indicator of a fatty liver is jaundice. It happens when the bloodstream has an excessive accumulation of bilirubin, a yellow pigment created during the breakdown of red blood cells. Bilirubin is effectively broken down and eliminated by the liver in a healthy state. Nevertheless, bilirubin builds up in the body due to the liver's decreased capacity to handle it as a result of fat storage. The accumulation results in a yellowing of the mucous membranes, skin, and eyes, which is known as jaundice. If you have any of these symptoms that we have mentioned above, you might want to visit your doctor and get your liver examined via an ultrasound test to see if you have a damaged liver.